Have you ever felt your stomach bloated tight and uncomfortable even after taking digestive medicine, yet the discomfort still lingers, or experienced dull pain in your lower abdomen, only to be told after a checkup it's probably nothing serious? But what if it isn't just ordinary indigestion, but rather your body's silent warning about something more dangerous? Every year, more than 313,000 women around the world are diagnosed with ovarian cancer. Sadly, over 70% of them are only detected at a late stage when treatment becomes extremely difficult. Why does this happen? Because the symptoms of this disease often hide under very familiar masks: bloating, frequent urination, indigestion, fatigue, all of which are easily mistaken for everyday issues. However, here's the good news: science has identified 12 early warning signs. If you recognize them in time, your chances of successful treatment increase greatly. Some of these signs may sound so simple that you'll be surprised. And especially the seventh symptom is one that doctors almost never mention, yet it appears in thousands of women from the very early stages. In today's video, I will walk you through these 12 symptoms, explain why they occur, share real-life stories from patients in the United States, and most importantly, when you should take immediate action to protect your life. If you find this content helpful, please consider subscribing to the channel and enabling the notification bell. To help me better understand, please leave a comment with a 1 if you'd like me to continue creating more videos on women's health, or a 0 if not. Every small piece of feedback from you helps me serve you better. Dear friends, health is our most valuable asset. Right now, let us begin with the very first symptom: persistent bloating, a sign that may seem minor but could be the knock on the door of ovarian cancer. The first symptom: persistent bloating. Bloating is a common sensation that many women experience. Normally, it may come from eating too much consuming foods that are hard to digest, or simply from the habit of drinking carbonated beverages. However, when bloating persists continuously, lasting for weeks, without easing even after adjusting your diet or taking digestive medication, that is something you must pay close attention to. In many medical studies, persistent bloating is considered the earliest and most common symptom of ovarian cancer. A study published in the Gynecologic Oncology Journal in 2023 showed that the majority of women in the early stage of ovarian cancer reported abdominal distension and discomfort. This is not the temporary bloating we all know, but a heavy feeling that causes clothes around the waist to become gradually tighter, even though body weight does not change significantly. I recall the case of Nancy, a 68-year-old woman living in California. She normally ate healthily, enjoyed salad and grilled fish, but in recent months, she always felt tightness and discomfort in her lower abdomen, even though she was eating less than usual. At first, she thought it was indigestion and bought digestive enzymes to take on her own, but her condition did not improve. When her daughter took her for an examination, we discovered she had a small ovarian tumor along with mild abdominal fluid. The regimen I suggested for Nancy included switching to a low-sodium diet, avoiding processed foods, and increasing the intake of fresh vegetables and fruits. I also advised her to split meals into smaller portions, 5 small meals instead of 3 large ones, to reduce pressure on her stomach. In addition, Nancy maintained a 20-minute morning walk around her block and practiced deep breathing to improve blood circulation and reduce stress. After 6 weeks, her bloating had improved significantly. Her sleep quality had improved, and the ultrasound showed that the abdominal fluid had not increased. Her blood pressure also stabilized, going down from 150/90 to 135/85. Most importantly, Nancy realized that persistent bloating is not simply a matter of food not agreeing with her, but rather a warning signal from her body. Safety note: if you have bloating lasting more than 2 weeks, especially when accompanied by pelvic pain, changes in appetite, or early satiety, seek medical care immediately. This is not a symptom that should be self-diagnosed or treated at home. The second symptom, pelvic pain or abdominal pain. A passing stomach ache is something anyone can experience, ranging from bloating and indigestion to changes in the weather. But if the pain appears in the lower abdomen or pelvic area, lasts for weeks, and keeps coming back without a clear reason, then it is no longer a small matter. Ovarian cancer often begins with dull ache similar to mild cramps or a dragging sensation. Sometimes the pain comes and goes, making many women mistake it for digestive problems or menopause-related discomfort. However, a study published in JAMA Oncology in 2023 revealed that 63% of women diagnosed with early-stage ovarian cancer had persistent abdominal or pelvic pain, often weeks or months before they knew they were sick. I recall Patricia, a 70-year-old woman from Texas. She thought her lingering lower abdominal pain was just her colon acting up because she ate a lot of spicy foods. She took stomach medicine, but it didn't help. The pain grew sharper, especially when she sat for long periods. When her family brought her in for a checkup, an ultrasound revealed a small tumor in her right ovary. The regimen I advised Patricia included changing her diet, cutting down on red meat, replacing it with steamed fish, and adding vegetable soup, drinking enough water, and limiting her intake of strong coffee. I also guided her to practice gentle yoga and take slow daily walks of 15-20 minutes to relieve abdominal pressure. After 8 weeks, she reported that her abdominal pain had eased significantly and her mood was much better. The medical results showed that the tumor had not progressed and she was ready to begin medical treatment in a stronger condition. Most importantly, she and her family understood that persistent pain should never be ignored. Safety note: if you experience pelvic or lower abdominal pain lasting more than 2 weeks, especially when it does not improve with common medicines, see a doctor. Do not just blame it on the stomach or the colon and miss the chance for early detection. The third symptom, feeling full too quickly. Have you ever taken just a few bites and already felt your stomach tighten as if you had eaten a big meal? If this happens only occasionally, it may simply be because you ate too fast or your stomach was sensitive. But if it happens repeatedly, even when you have eaten very little, it is a sign worth noting. In ovarian cancer, as the tumor grows, it can press against the stomach and nearby organs, reducing stomach capacity. As a result, after only a few bites, you feel completely full. In addition, some patients develop ascites, fluid buildup in the abdomen that increases pressure and causes an abnormal sense of fullness. A study published in the Indonesian Journal of Cancer in 2024 showed that early satiety is common among patients with advanced ovarian cancer, often accompanying bloating and pelvic pain. Unfortunately, many women dismiss this warning, believing that eating less is good. I once treated Carol, a 67-year-old woman from New Jersey. She used to enjoy family dinners and always finished her portion. But recently, she could only manage a few spoonfuls of soup before feeling full and losing her appetite. Her daughter thought it was just due to aging. But when Carol began losing weight rapidly, the family brought her in for tests, and we discovered an ovarian tumor with abdominal fluid. I advised Carol to adjust her eating habits by switching to smaller, more frequent meals and focusing on easy-to-digest foods such as oatmeal, steamed fish, and boiled vegetables. She also took short, slow walks of 10 to 15 minutes after meals to aid digestion. After 6 weeks, she was able to eat better and no longer felt overly full too quickly. Her weight stabilized and her spirits lifted as she prepared for further treatment. The lesson is clear: feeling full too quickly is not always harmless. If this happens day after day, especially together with bloating or pelvic pain, it is a sign that your body needs attention. Safety note: if you frequently feel full too quickly, see a doctor. Especially if this is accompanied by weight loss, bloating, or fatigue, serious conditions must be ruled out. The fourth symptom, frequent or urgent urination. Sometimes needing to urinate many times a day can simply be because you drank a lot of water, took diuretic medicine, or because aging has made your bladder more sensitive. But if this problem appears, suddenly lasts for weeks, and has no clear cause, you should be cautious. The ovaries lie right next to the bladder. When a tumor develops, it can put direct pressure on the bladder, reducing its capacity to hold urine. The result is that you feel the need to urinate constantly, sometimes right after you just went. Many women mistake this for a bladder infection or urinary tract infection, but the truth may be much more serious. A study published in the Journal of the American Medical Association showed that 55% of women with ovarian cancer reported abnormal urinary symptoms, compared with only 32% of women without the disease. This proves that changes in urinary habits are a warning sign that should not be ignored. I recall Eleanor, a 72-year-old woman from Florida. She often had to wake up to urinate 5 or 6 times each night, which disrupted her sleep. Thinking she had a urinary infection, she drank lots of water and used leftover antibiotics. But her condition did not improve. At the hospital, we discovered a small ovarian tumor pressing on her bladder. The regimen I advised Eleanor included cutting down on coffee and carbonated drinks, which can make the bladder more sensitive, and eating more vegetables, steamed fish, and brown rice. I also suggested that she practice Kegel exercises to strengthen her pelvic floor muscles, which would help improve her bladder control. After 7 weeks, her nighttime urination dropped to only 2 or 3 times. Her sleep improved and she felt more energetic. The takeaway: when urinary habits suddenly change and persist, especially frequent urgency without burning pain, you should not overlook it. This may be your body's message that something is wrong with the ovaries. Safety note: if abnormal urinary symptoms last longer than 2 weeks, see a doctor right away. Imaging tests of the pelvic area will help identify the cause and rule out ovarian cancer. The 5th symptom: persistent fatigue. We have all felt tired after a long day, whether due to a lack of sleep or excessive work. But unlike normal tiredness, the fatigue related to ovarian cancer lingers for weeks, even months, and does not improve even with proper rest. Our brain and body require stable energy to function properly. When a tumor grows, it consumes a significant amount of energy and disrupts cellular metabolism. At the same time, the chronic inflammation caused by cancer cells leaves the body constantly exhausted. A study in the Cancer Nursing Forum showed that more than 50% of women with ovarian cancer described unusual fatigue even at an early stage. I remember Janet, a 69-year-old from Oregon. She was normally very active, often walking around her block and joining senior dance classes. But recently, she often quit halfway through, complaining that her body felt as heavy as lead. Her daughter suggested she rest, but even after sleeping 8 hours a night, she still felt drained. When we examined her, we discovered she had early-stage ovarian cancer. The regimen for Janet included improving her diet with more protein-rich foods, such as fish and boiled chicken, combined with vegetables and whole grains. She was also advised to practice gentle yoga for 15 minutes each morning and to maintain a consistent sleep routine. After 6 weeks, Janet reported feeling more energetic with a clear decrease in fatigue and was able to return to her dance class with friends. The key point is that unusual, prolonged fatigue with no apparent reason should never be dismissed. It is not always just aging or working too hard. It may be your body's way of signaling that it is fighting a serious illness. Safety note: if you experience persistent exhaustion for more than 2 weeks without improvement despite maintaining a good sleep and nutrition regimen, consult a healthcare professional, especially if fatigue is accompanied by bloating, abdominal pain, or changes in urination. The 6th symptom: pain during sexual intercourse. For many women, changes in sexual life are often attributed to aging, menopause, or hormonal shifts. However, one commonly overlooked sign of ovarian cancer is pain during sexual intercourse. Unlike the temporary discomfort that may come from vaginal dryness or hormonal changes, the pain linked to ovarian cancer is usually a sharp, deep ache in the pelvic area that recurs again and again. This occurs because as the tumor grows, it can press on nearby nerves, tissues, and muscles, resulting in inflammation and tension. A study in American Family Physician in 2021 found that women with early-stage ovarian cancer had a significantly higher rate of painful intercourse compared with other groups. Worryingly, most of these women had ignored it or assumed it was simply a natural part of aging. I once cared for Angela, a 66-year-old woman from New York. She had been postmenopausal for many years and thought the pain she felt during intimacy was just normal. But the pain grew stronger, leaving her insecure and distant from her husband. When she came for a checkup, we discovered a small tumor in her ovary and signs of inflammation around the pelvic region. The recommended plan for Angela included adopting a diet low in saturated fats and rich in vegetables and fruits, with the addition of olive oil and salmon to help reduce inflammation. I also encouraged her to engage in gentle exercise combined with pelvic floor relaxation therapy. After 7 weeks, Angela reported less pelvic tension, a brighter mood, and most importantly, she regained closeness with her partner. The lesson here: when sharp pain during intimacy persists, don't assume it is just hormones or aging. It may be your ovaries sending an urgent warning. Safety note: if you experience pain during intercourse lasting for many weeks, see a gynecologist. Early detection ensures effective treatment and overall protection of health. The 7th symptom: irregular menstrual periods. A woman's menstrual cycle is like a biological clock. When this rhythm becomes irregular, sometimes arriving too early, sometimes lasting unusually long, or with much heavier bleeding than normal, it is a sign that deserves special attention. Many women believe irregular periods are only the result of aging stress or hormonal imbalance. But research from the International Journal of Cancer shows that women with long-term irregular menstrual cycles have double the risk of developing ovarian cancer at age 70 and nearly triple the risk at age 77. This indicates that hormonal imbalance may lay the groundwork for the silent development of the disease. The case of Melissa, a 64-year-old from Chicago, has stayed with me. For many years, she often faced irregular cycles, sometimes only a few weeks apart, other times lasting more than 10 days. Each time she saw a doctor, she was reassured that it was early menopause. But when her lower abdomen began to feel tight and uncomfortable, she finally went for a more detailed exam. The ultrasound revealed an early-stage ovarian tumor. I advised Melissa to change her habits by replacing processed foods with boiled vegetables, fresh fruit, and grilled fish, and reducing her intake of sugar and soft drinks. Additionally, she practiced gentle exercises such as yoga and took daily 20-minute morning walks. After 8 weeks, her fatigue from irregular periods decreased significantly, her lower abdomen felt more comfortable, and her blood pressure was controlled at 132/82. The lesson here emphasizes 1 point: irregular menstrual cycles are not just an inconvenience. They may be a hidden letter from the body signaling ovarian problems. Safety note: any persistent changes in the menstrual cycle, whether shorter, longer, or heavier, should be checked by a gynecologist. Listening closely to your body can make a major difference in treatment outcomes. The 8th symptom: persistent indigestion or heartburn. That burning sensation in the chest after a meal or the heavy, uncomfortable feeling in the stomach is very common. Sometimes it is just because you ate too quickly, used a lot of spicy food, or drank strong coffee. However, when indigestion and heartburn become regular visitors every day and do not respond to common medicine, it is a frightening warning sign. A study from the Ovarian Cancer Screening Program in the UK reported that 35% of women in the early stage experienced digestive issues such as heartburn, bloating, or indigestion. Remarkably, this rate was even higher than some of the gynecological symptoms that are usually emphasized. This proves the digestive system can serve as an early mirror of ovarian problems. I remember Donna, a 71-year-old from Arizona. She used to enjoy her morning coffee and butter-filled sandwiches. But recently, she kept suffering from heartburn, a burning sensation rising from her chest to her throat. Thinking it was a stomach issue, she took antacids, but they didn't help. When she came for an exam, the ultrasound revealed a small ovarian tumor pressing on her stomach. We adjusted her lifestyle by reducing her coffee intake, avoiding oily and fried foods, and replacing them with oatmeal, vegetable soup, and grilled salmon. She also practiced 15-minute walks after meals to aid digestion. After 6 weeks, Donna reported that her heartburn had greatly decreased, her mood had improved, and eating had become more comfortable. The lesson here, persistent indigestion or heartburn, is not just about irregular eating. When your body continues to send discomfort signals after meals, pay attention to them. Safety note: if digestive symptoms last more than 2 weeks and do not improve with common medicine, see a doctor to rule out serious conditions, including ovarian cancer. The 9th symptom: abdominal swelling from fluid ascites. When the belly gradually grows larger, many women immediately think of gaining weight. But when your waistline increases without actual weight gain and your clothes become tighter, it may not be fat at all. It could be fluid buildup in the abdomen, a condition called ascites. In ovarian cancer, cancer cells can irritate the abdominal lining, causing fluid to leak into the abdominal cavity. The result is a stiff, bloated abdomen that brings difficulty breathing, eating problems, and a heavy sensation. According to Nature Review's Cancer 2015, most women diagnosed with ovarian cancer already show signs of ascites ranging from moderate to severe, and this is a marker of advanced disease. I once treated Teresa, a 73-year-old woman from Nevada. She thought her growing belly was due to a lack of exercise, but although her old clothes no longer fit her actual weight, had not increased. Over time, she found herself short of breath when climbing stairs and feeling full too quickly during meals. Ultrasound revealed a significant amount of abdominal fluid along with an ovarian tumor. The recommended plan included eating with minimal salt to reduce fluid retention, increasing consumption of vegetables and fruits, adding steamed fish and boiled chicken, and avoiding processed foods. Teresa also practiced gentle daily walking for 10 to 15 minutes and ensured proper rest. After 6 weeks, her bloating, decreased breathing became easier, and her spirits lifted as she prepared for further treatment. The key message: an unusually enlarged abdomen is not always caused by fat. When your waistline expands rapidly without a clear reason, it is a signal that you should never ignore. Safety note: if abdominal swelling is accompanied by shortness of breath or a feeling of fullness, seek medical attention immediately and consider an ultrasound to rule out potentially serious conditions. The 10th symptom: persistent nausea and vomiting. Occasional nausea can result from eating the wrong food, motion sickness, or even a mild case of the flu. But when nausea and vomiting repeat day after day without any clear cause, it becomes a serious medical warning. As an ovarian tumor grows, it can press on the stomach and intestines, slowing down digestion or even causing partial obstruction. This makes it difficult for food to pass, leading to ongoing nausea and vomiting. A study published in Gynecologic Oncology in 2022 revealed that nearly 36% of women diagnosed with ovarian cancer reported recurrent nausea and vomiting, and many cases were initially mistaken for simple digestive issues. I once worked with Laura, a 70-year-old from Pennsylvania. She had always been healthy and enjoyed dining with friends, but for several weeks she suffered from constant nausea, often having to abandon her meals halfway. At first, she thought her stomach was weak, but when the vomiting became so severe that she lost weight rapidly, she finally sought medical help. We found an ovarian tumor pressing on her stomach, obstructing digestion. The supportive plan for Laura included switching to soft, easy-to-digest foods such as oatmeal vegetable soup and steamed fish, splitting her meals into smaller portions, and drinking warm water instead of strong coffee. She also developed the habit of taking a 10-minute walk after meals to help reduce digestive stagnation. After 6 weeks, her nausea had improved significantly, her weight had stabilized, and her overall mood had improved substantially. The main point: persistent nausea is not always just about the stomach. If it is accompanied by bloating, weight loss, or abdominal pain, you must consider more serious conditions. Safety note: if nausea or vomiting continues for many days, especially with weight loss, see a doctor immediately. Taking anti-nausea drugs only hides the symptoms without solving the root problem. The 11th symptom: pain in the legs or thighs. When people think about ovarian cancer, very few imagine pain in the legs or thighs. Yet for some women, this is exactly one of the early signs, often mistaken for muscle aches, joint pain, or simple age-related degeneration. The cause is that a growing ovarian tumor can press on nerves and blood vessels in the pelvic region, making blood circulation difficult and triggering deep pain in the thigh or calf. Many describe it as a lingering cramp or sciatica-like pain, but in reality it is pressure from within. A case report in the American Case Reports Journal, 2024, described a 31-year-old woman who suffered from tailbone pain and numbness in her right leg for 2 years, misdiagnosed as a musculoskeletal problem. Finally, with thorough imaging, doctors found a large ovarian tumor spreading into the pelvic area, and after surgery, her leg pain disappeared completely. From my own experience, Catherine, a 74-year-old woman from Washington, had persistent pain in her left thigh, especially when walking long distances. She thought it was knee degeneration, but when the pain spread down to her calf, her family took her for a checkup. Ultrasound of the pelvic region revealed an ovarian tumor pressing on a vein. I advised Catherine to follow an anti-inflammatory diet, more grilled salmon, leafy greens, and olive oil, while cutting sugar and fried foods. Additionally, she practiced gentle leg stretches every morning and took slow 15-minute walks. After 6 weeks, her thigh pain decreased significantly. She walked more comfortably. Her blood pressure stabilized at 130/82, and her mood improved as she prepared for the next stage of treatment. The takeaway: persistent pain in the legs or thighs is not always due to issues with bones or joints. When it lasts for weeks and does not improve with common painkillers, you must think of more serious causes. Safety note: if leg pain comes with swelling, redness, or a history of heart disease, see a doctor right away. Do not rely on massage or prolonged painkillers, as they may hide the 12th symptom: abnormal vaginal discharge. Vaginal discharge is a natural process for women, typically clear, light, and odorless. But when it becomes abnormal, more excessive, turning yellow-green or brown, or developing a foul smell, it is an urgent signal your body is sending. In many cases, abnormal discharge comes from simple gynecological infections. But some studies show that early-stage ovarian cancer and cervical cancer may also present with unusual discharge caused by hormonal changes and ongoing inflammation. The danger is that many women downplay it, thinking that using suppositories or cleansing products is enough while the tumor continues to grow silently. I recall Helen, a 72-year-old from California. She noticed increased discharge, brown in color with an unpleasant odor. Thinking it was an infection, she bought medicine on her own, but it did not resolve the issue. Later, when the discharge was accompanied by lower abdominal pain, she finally came to the hospital. Tests revealed a small ovarian tumor requiring immediate treatment at an early stage. The plan I recommended for Helen included gentle hygiene using mild cleansing solutions, changing cotton underwear daily, and maintaining a healthy diet consisting of vegetables, steamed fish, and fruit. I also reminded her not to use suppositories indiscriminately, but only under medical guidance. After 6 weeks, her discharge had clearly reduced her health, had stabilized, and she felt reassured as she entered further treatment. The important message: abnormal discharge is never a symptom to ignore. It may be your body's reminder that it needs a thorough checkup. Safety note: if your discharge changes in color, smell, or comes with unusual bleeding, consult a gynecologist immediately. Treating yourself at home only delays detection of the disease. Conclusion: we have just gone through 12 early warning signs of ovarian cancer. From seemingly simple symptoms such as bloating, abdominal pain, and fatigue to unexpected ones like leg pain or abnormal vaginal discharge, all are silent reminders from the body appearing before the disease advances to later stages. The most important thing to remember is this: if any symptom lasts longer than 2 weeks and does not improve with usual measures, see a doctor right away. Do not dismiss it as just aging or minor discomfort. Statistics show that more than 70% of women are only diagnosed with ovarian cancer at an advanced stage when treatment becomes far more difficult. The good news is that if detected early, the chances of effective treatment and maintaining a quality of life increase significantly. And it all begins with listening carefully to your body. If you found this information helpful, please consider subscribing to the channel and sharing it with your friends and family. Every bit of support helps me continue creating health content designed especially for you, so together we can live healthier, more peaceful lives while actively preventing disease. Remember, health is our most precious asset, and even small changes in awareness today can save a whole life tomorrow.